Hello and good day everyone. I am Anita Yassin. I'm from Keningau Vocational College, Sabah, Malaysia. Today I would like to present my thesis entitled Designing Effective Health Education Based on Student Perception on Obesity and Healthy Lifestyle. The aim of this research was to identify student perception on obesity. The rate of teen obesity is rising quickly, and the increasing influence of teenagers' daily life has led to sedentary lifestyle with lack of exercise and poor diet. This study is significant in order to examine the students' understanding on health issues as well as their habit in order to design proper approaches in educating them to be more responsible for their own health. Globally, obesity has become an epidemic problem and has been tripled since 1975. Obesity is a leading preventable cause of death worldwide, with increasing prevalence in adults. Children and authorities view it as one of the most serious public health problems of the 21st century. Obesity defined as an abnormal accumulation of fat in the adipose tissues throughout the body. Obesity is a medical condition in which excess body fat has accumulated to the extent that may have an adverse effect on health. And actually it's a treat and higher risk to develop heart ailment, chronic disease and diabetes. Sedentary lifestyle with lack of exercise, unhealthy dietary pattern, or both of these behaviors are the major cause associated to obesity. Problem statement. Number one, lack understanding how overweight and obese people consider themselves regarding their weight. One reason for the unsuccessfulness of previous health intervention could be the lack of understanding how overweight and obese teenagers consider themselves regarding their weight. Understanding the perception of this particular group of people is important to identify the factor that hinder overweight and obese teenagers from not practicing healthy behavior, which in turn is helpful to plan appropriate and effective health intervention. Overweight and obese individuals on view can also provide us the best way in which health intervention can bring about positive outcome. Number two, lack of awareness and understanding in healthy eating habit and lifestyle. Meaning to say that unhealthy eating habit refer to failure in fulfilling the eating patterns that the body require. Nowadays, teenagers like to hang out and love eating outside the home, and they usually went to fast food restaurants such as McDonald's, KFC, Sabah, and so on. This brought more fatty food, more snack food, and high calorie. Sometimes there are overeating because of anxiety, for example, work stress or depression, and none of these are healthy. Lack of physical activity has clearly been shown to be a risk factor for cardiovascular disease and other conditions. Less active and less fit people have a greater risk of developing high blood pressure. My research objective is to identify the factors that influence the perceptions of overweight and obese people, to increase healthy eating habits and good lifestyle, to increase physical activity. My research statements are to identify what is the best way to overcome obesity. And this study also is important to help prevent obesity problems from being overwhelmed. Cause and effect of obesity. Number 1, detrimental psychological. According to Heather L. Paxton, claimed that obesity might have detrimental psychological effect on school students, as being in such condition makes them feel insecure and develop low self-esteem. In comparison with students who do not experience this problem, this causes them to suffer emotionally. Second, low self-esteem. Body dissatisfaction has been linked to low self-esteem and a high BMI. Depressive symptoms have been associated with a perception of not being the appropriate weight, according to Martin Nemeth. Girls tend to report more depressive symptoms associated with weight than boys. In fact, girls report more depression and low self-esteem than boys. Number 3, sedentary lifestyle. The increasing tendency to simply realize in sedentary lifestyle in the era of mobile technology with extensive usage of internet has exacerbated this problem among the public. A majority of the population prefer to occupy themselves with television, computers, and mobile gadgets and confine themselves at home and on their couches during leisure time. Obesity among teenagers. Teenagers did not understand their own physical growth and how their daily routine affected their bodies, and this often results in sudden and drastic changes, such as weight gain that they could have prevented if they exercised concern in their lifestyle. Obesity among school students can be attributed to poor eating habits. According to Al-Hazar, claimed that over 80% of teenagers aged 15 to 19 years old spend most of their leisure with televisions and gadgets, and many of them did not regularly consume fruits and vegetables in their daily meals. Obesity in Malaysia. Malaysia has been ranked as one of the countries that had the highest rate of obesity in Asia, and this could be due to the poor eating habits of the citizens, including the people's proclivity to indulge in busy eating. My research design of this study used a combination of survey and correlation method. Variety of techniques are described, including the use of statistic testing, descriptive and inference based on questionnaire. My research locations are from 2 vocational colleges, Keningau Vocational College and Tower Vocational College, located in the interior northern Sabah and the southeast coast of the state. My subject for this study were 380 students. These students were from 2 hospitality programs. They are from culinary arts and baking and pastry. This questionnaire consists of 3 sections. Part A is related to the respondent backgrounds. Part B refers to self-esteem, while Part C studies the perceptions of vocational college students on obesity based on HBM model. A pilot test was conducted on 100 respondents from a vocational school. It was discovered that only 85% of the responses were properly completed and therefore considered valid, while the remaining responses were incomplete. Preliminary finding: unhappiness with physical appearance. Based on the finding, majority of the students admit that they were not happy with their physical appearance, and there were many things about themselves that they wish to change. They also have the tendency to compare their physical look with their peers. In fact, many of them felt that they did not earn the same social approval as their peers. This could be highly related with how they rated on self-esteem, which was there acknowledged to be lower. Preliminary finding: optimism. However, despite their low rating on how they perceive their physical appearance and self-esteem, they express their optimistic thought on how they did not give up easily, and they also did not see themselves as a failure. Unsuccessful attempt in losing weight. Almost a quarter of students claim that they were not happy with their current body weight, while some from this group considered themselves obese. Most admit that despite their desire to lose weight, they have not been successful in realizing any weight loss plan. My conclusion for this research hopefully could shed some lights on how students' understanding of body weight, healthy eating styles, and obesity can help them make a wise decisions and choices in their habits and routine. This is essential in educating our school students to be responsible of their own health and happiness. That's all from me. Thank you for joining and have a nice day. Bye.